Good afternoon, St. Louis. Thank you for joining us this afternoon, this Wednesday afternoon. We're going to talk about a couple of things today, primarily COVID, and then, of course, we will take your questions today. So, with regard to COVID, really no good news on that front. In terms of the numbers, we had 144 new cases in the city of St. Louis yesterday. Our average for the last 7 days is 140. That's down a little bit from what it was, 5-6 days ago. But we think that that's probably a result of some latent reporting having to do with Thanksgiving and that lab work and that sort of thing. So we're going to wait a little while, till we figure out whether there's actually a slight decrease or not. Our gut instinct tells us there is not, and that mostly this is a reporting issue. We'll know more about that in a week. And of course, we continue to be concerned about the surge within a surge that will, we believe, result from the Thanksgiving holiday. So that's, we all need to continue to do the things that we know we need to do. Wear a mask, it's not tough. And keep your gatherings small, and don't get together with people that are not in your core group, your small group. That is hard. That's harder than not wearing a mask. I understand that. But it's also very important. So with regard to hospitalizations, these are numbers within the region. These numbers just continue to go up. As of yesterday, and these numbers lag 2 days behind, as of yesterday, total people in the hospital with confirmed COVID positive in the region, 962, another 100 people, 99 to be exact, which are suspected of being COVID positive. So we're at 1,061 people in the hospital. This is an all-time high. I'm gonna look back to be sure. Yeah, this is an all-time high for the number of people in the hospital. Hospitalization lags behind the positive tests, of course. And so as we've seen this big increase, this big rise in the number of people that are positive, not just in St. Louis, in fact, not so much within St. Louis, but in the region and in outstate Missouri and Illinois, we are continuing to see an increase in hospitalizations. Hospitals are, they're out of staff is what it really amounts to, is just not enough doctors, not enough nurses, not enough folks to all the other related clinical care that it takes to run a hospital. So 1,061 people in the hospital 2 days ago, and over 200 people in the ICU, and 123 people on ventilators with confirmed COVID positives. 118 people admitted to the hospital 2 days ago, 131 discharged. So those hospitalization numbers are very, very serious, very, very serious numbers. Not just because of the people who have COVID who need to go in the hospital, but people are continuing to have other acute care needs. People continue to have heart attacks and strokes and break their leg and get in car accidents and have appendicitis. And all of those other emergencies that we, of course, want our hospitals to be able to care for, in addition to ongoing medical treatment for any number of diagnoses that happens within our hospital. So was on the pandemic task force call yesterday afternoon. We have a call every Tuesday afternoon, and the hospitals are just quite beside themselves, I think is an accurate way of putting it, that They want to care for everyone to the highest level possible, and they're just very concerned that they won't be able to do that if these numbers continue to go up in the hospitals. So that is COVID. And here we are heading into, more holidays. And so you're going to be hearing more from me and from all of us about this. But I don't think Christmas looks much different than Thanksgiving in terms of family gatherings, whether you're, whatever holiday that you celebrate around this time of year. It's going to continue to be, it looks like, very important to keep the group small. I hope you all prove me wrong on that. I hope that our good behavior, that changes in our behavior, sends our numbers down. So I challenge you, prove me wrong on that. Let's get our numbers down. But if they continue to stay as they are, Christmas holidays are not going to look much different than the Thanksgiving holiday did, unfortunately. I think there's some good news happening, and that has to do with the vaccines that we see are going to be rolled out. Missouri is supposed to get our first distribution of vaccines in about 10 to 15 days, middle of December. Looks like we will be getting both some Pfizer vaccines and some Moderna vaccines. And the good news, that is good news, of course. But I think that good news is, what's the word? That good news is making some people not pay attention to the warnings about hospital capacity, about the need to wear a mask, continue to socially distance. We've got to get through this until we have some widespread vaccine distribution. And I'm so glad that that is on the horizon. But we've got to continue and double down on the behavior changes that we need in order to keep our numbers down, because we've got to get to that vaccine. And while we'll get the first few doses, it's not a few, it's 150,000 doses in the middle to late December. We expect those will first go to healthcare workers, as I think they should. And then there'll continue to be shipments of those vaccines. So it's going to be several months before it is widespread inoculation for people. So don't just jump right to getting a vaccine. Stick with us here on wearing your mask, keeping your group small, because we are seeing more and more people getting very, very ill and dying from COVID. So you got to be able to have both of those pieces of information at once and act accordingly. So that is COVID. One other subject I want to point you to. This is a good news topic. This morning, MLS Soccer, St. Louis Soccer Club, announced some new renderings of the new stadium. And we'll post a link to it. I think it's already on my Facebook page, actually. Pictures, renderings of the new stadium from various views, and the entire link from the stadium to Union Station down to the arch. And they're really great looking. If you have not been downtown in a little while, take a ride and come down and just drive down Market Street or Olive Street, either or both, and you'll see the tremendous amount of construction that's going on the soccer stadium site. And so that's some really encouraging news for a lot of reasons. One, it's fun news. Two, we've got a lot of people working there at that site. That's providing a lot of jobs. So good news on that front. I know we're all excited about that. So I think that's the only other subject I wanted to visit about. Do we have any questions, Jacob?
Quite a few questions today.
Okay.
So first question that came in today is from Sharika, Mayor. Asked about the possibility about another shutdown at some point, and are limited hours still in place for businesses like restaurants and bars?
Sharika, we hope to avoid a further shutdown, but it's not off the table. So our behavior will determine whether or not we have to have a further shutdown. I hope not, but maybe. The second part of your question, yes. Occupancy limitations for bars and restaurants and closing time at 11 p.m. is still in place. And I expect it will be in place for a while.
Question from Christopher today, Mayor, asking about the average turnaround time for getting test results for COVID-19 in the city of St. Louis.
So Christopher, it is bumped up a little bit in the last week or 2 weeks to it's now averages around 5 days. It's bumped up because so many people were getting tested, trying to get tested right before Thanksgiving. And so, you know, it becomes a lab capacity issue, but hopefully we'll see that go back down. Let me look at a sheet of paper I've got here, which, whoops, I'm gonna look back at the last one. Yeah, just a little under 5 was the average for last week. And of course, last week was probably slower when you consider you had Thanksgiving, the day after Thanksgiving, and then a weekend. So a lot of people, as we look at the daily results, a lot of people are getting their results back in 3 days. So, but not everybody.
We have 2 questions about special session in Jefferson City. Have you talked to Governor Parson about CARES Act funding needs in the city, and where does the request stand to try and get more money?
I have spoken with Governor Parson about that. At this point, there is no change in additional CARES Act money to the city, although some of the programs which they are trying to get through Jeff City, we may be able to apply for some of those funds, but it wouldn't come direct to the city. It'd be a program-driven thing.
So Colleen's question related to that is, what are the remaining needs in the city of St. Louis related to COVID that you would use additional CARES Act money for if you could get it?
Oh, I would use it for homeless services. I would use it for rental and mortgage assistance. I would use it for more assistance for small businesses that are being very severely impacted by this. All of those things, because, you know, when the first CARES Act money came out, no one, well, maybe somebody did. I didn't think, and most people did not think, that we would be in the throes of a third surge right now. But we are. So we certainly need additional funding. I know Congress, yesterday I received an email from the individual who represents us in Washington, the city of St. Louis in Washington. Not the congressman, but this is a federal lobbyist that we work with an update on the potential for some additional stimulus funds. I have not seen any news today that anything has happened. I mean, you haven't seen that, have you? But I'll be honest with you, we've been hoping for that for a couple of months, maybe longer. And so we're certainly not counting on it, but the need out there now is much greater for both individuals and for businesses than it was back when the first CARES Act funding was put in place. So.
Chrissy's question about a stay-at-home order is, what is different or what has changed from the spring when the area did go on a pretty significant lockdown to not go on one right now?
So, Chrissy, what is the tenor of that question? Why don't we have a lockdown?
Like we did in the spring.
Yeah, why don't we do everything like we did in the spring? Well, we know a lot more now, number one. The healthcare professionals know more about how to treat COVID. We have better contact tracing, better quarantining among folks who have been exposed. And we also know and saw the impact of this shutdown order on people, on jobs. And so we're trying to balance the two things. I know that there are people out there, I get your messages that want me to shut down all businesses everywhere. You know, the approach that we've taken here is we know through our contact tracing that this is spreading in small groups, among family members, among neighbors, among friends who are getting together. Somebody's positive and then everybody's exposed. Somebody else gets it. We know that's where it's happening, which is why we're asking you to curtail that behavior so that we don't have to shut everything down. I mean, you know, we shut down, schools were shut down, bars, restaurants, theaters, malls, shops, gyms, hair salons, all of that was shut down for 8 weeks in the spring. Now, there's some school of thought that, of course, that worked to some extent in reducing the numbers, but as soon as we tried to ease back into things, you know, that shutdown caused people to really go full steam ahead in some cases, and that's why we had the second surge, and it's part of the reason we're having the third surge. So we need compliance, particularly with mask wearing. And I will stop and say the people of St. Louis City have done a really excellent job with that. Can always do more. We're always asking you to do more. But you've done a good job, which is why our numbers in the city of St. Louis are better than any place else in the region. So,
Charlotte has a question about, can we report businesses who are not making people socially distance and wear masks, etc.?
of course, Charlotte, I mean, we've been talking about this for months. Call 622-4800 for a phone call. You can tweet it at STLCSB, or you can put in a complaint online, complete with pictures, addresses, by just going to go on the city's website. There's a little tab that says make a complaint. You can do it there as well. So yes, and we follow up on it. You've seen, we've closed down a number of businesses that were not following mask mandates and social distancing, usually for just 2 weeks. We've closed some businesses for not following the 11 p.m. closing time. So that's not what we want to do. We want to make it so that these businesses can operate safely, and many of them, the vast majority of them, have done a great job of implementing the mitigation strategies that we've asked them to implement. So we don't want to shut anybody down. We want to make it so they can operate and employ people. But if you've got an issue, absolutely let us know about it.
You mentioned schools. Diana had a question about schools, Mayor. Are schools in the city causing or contributing to this third surge in COVID-19 cases? And do you anticipate a recommendation from the health department asking them or telling them to go back completely virtual?
At this point, we don't have evidence that schools are contributing in any major way to an increase in the number of cases. So right now, as you know, some schools are full-time in class, some schools are full-time virtual, some have a balance of the two. And so I think each one of those is working it out in conjunction with their parents.
Janine had an interesting question about COVID, Mayor. What is the projected impact on the city's finances due to, well, COVID, but the loss of earnings tax from non-city residents working from home outside the city?
So the budget that we adopted back in late June projected that the city would have a $67 million reduction in our revenue. That's a lot of money, $67 million. People that are working from home, whose company is in the city of St. Louis and they live outside the city of St. Louis, we believe still owe the earnings tax because you're still using the internet, the office, the assets of the office in order to generate that work. So we believe that the earnings tax is still needed from that situation.
So we have questions on other related topics, Mayor. Lindy, who I think is a regular viewer, asked about 2 shootings in 30 days at a location in the area of Gravaway and Eichelberger, South St. Louis.
Mm-hmm.
When something like that happens, is there something the city can do to try and respond to that, help protect the folks there, and get the situation under control?
So I know that business that you're talking about, and yes, that business needs to follow the guidelines that we've set up. Just because a business has 2 shootings within 30 days does not necessarily mean that they would be closed, but they may be considered a nuisance if this is related to their behavior or behavior of their patrons, and so they may go through that nuisance process as well. And maybe you don't go there.
Since winter outreach for the unhoused has begun,
Mm-hmm.
a few folks have submitted questions asking if the city is considering expanding capacity through more hotel spaces or motel rooms as COVID-19 continues into 2021.
At this time, probably not more motel rooms. We've, unless there's a space that somebody is aware of that is able and willing to do that. We scoured the area, and we do have several folks that are in hotel rooms at this point in time, but not every hotel is willing to take that. So as you know, we are working on the tiny house situation. I think it was last Wednesday, a week ago, we got passed through E&A a lease for a site at 900 North Jefferson, where we expect to put 50 tiny homes. 25 of those tiny houses are built out. We are waiting on that lease to get signed. It should be literally any day. And when that begins and we begin installing those tiny homes, it won't take much. We've got to connect the electricity and that sort of thing. But so within a short period of time, we will have 50 tiny homes at the lot at 900 North Jefferson. We may also, if needed, we may expand to some other locations, maybe recreation centers, other locations on a temporary basis. But right now, we think we've got a decent balance going on. Now, it hasn't been cold for very long, just a few days. And, so often it's very difficult to get people willing to come in off the street. That takes a lot of skill and for outreach workers. We continue to do that all the time, day in and day out. And sometimes as the cold weather goes on longer, then people are more willing to come in. So it's for their own safety for them to come in off the streets.
Last question, because it is almost 2:30, on another topic. Stacy would like to know if you have an update on the Board of Freeholders, or if the city could just say it's not going to happen.
No, I think it will happen, Stacy. I'm working with some folks at the Board of Aldermen on that as we speak. So I think we will make, I will make other nominations, and whether or not the Board of Freeholders convenes itself, that'll be up to them. So
That's it for questions today.
that's it. Thank you all. Appreciate you being with us today, and we'll be back to talk to you on Friday. Thanks so much.